What's going on, guys? It's Caden Cleveland here with the Oklahoma Senate, and you're joining us for another episode of our budget breakdown series with Senator Roger Thompson here, of course, who's our appropriations chair in the Senate. Senator, thank you so much for having us again this week.
Always excited.
Absolutely.
For you to drop by and for a little lesson from the whiteboard.
Absolutely, just to learn everything, or learn a little bit about our budget, our Oklahoma State budget. If you're not familiar with this new series that we've introduced, what it is exactly is we kind of go to the board and learn from our appropriations chair what is going on with our state budget and what with the process of developing a new budget for this next fiscal year. You know, where are we at in the process? So I guess with that, the past few weeks we've looked at the starting point, where our appropriated starting point will be for this next fiscal year, and then also with that we've looked at where those off-the-top expenses are going to be focused before that money can be given to our state agencies. Is that correct?
Absolutely.
Okay,
yeah.
gotcha.
Remember, we first started this 3 or 4 weeks ago, and we looked at the $612 million.
Right.
And then we went down and we just broke it down, everything that would come off of there to date.
Right.
That would come off of that 612. And then last week, you and I got together and we talked about the ad valorem.
That's right.
And for a while. And so this week, we'll talk about a few federal dollars.
Love it.
And because we are dependent upon federal dollars, and we're part of the federal government, so we ought to get some of those dollars.
Right.
And so when we look at the healthcare budget, it's about $1.1 billion. But if you add all of the other funds that flow through the healthcare authority to the state of Oklahoma, it's about $5.7 billion. Wow.
Okay.
Okay, so this year we had some changes. In 2001, we had what was the 1115 waiver. And the 1115 waiver says you can use Medicaid funds for your teaching hospitals, your graduate medical education, GMEs, and you could use those because generally at your teaching hospitals, you have folks coming in that can't really afford treatment, and so therefore Medicaid dollars can be used for that. Okay, so this last year, the federal government decided, even though you've done this since 2001 on the 1115 waiver, we're not going to allow that anymore. And so in our last fiscal year, they were saying, not only are you not going to do it, but we're going to take some money back.
Really? Okay.
And so we had to add $110 million last year to our budget just to keep our teaching hospitals open. That's 6 quarters of financing.
Wow.
And so as we look at this next year's budget, our graduate medical education will have to pay the $63 million ourselves.
Gotcha. Because we're not receiving those federal funds. Gotcha.
They're not coming any longer. And so this program, as far as we know, is over. And we will continue to have to pay that from this day forward.
Wow.
Now, as I made mention a while ago, not only do we have the graduate medical education will pick up $63 million, they clawed back 2 quarters, as we talked about a moment ago.
Yeah.
But they're also now, they're clawing back another $31 million that we're going to have to send back up to the federal government. And that's money they've already given to us, but they're saying we want it back because not only were we not going to fund this last year, we're going to take the money from the year before back that we've already given to you.
Okay, so this the breakdown for today is talking about our federal money that we had received, or that we can kind of attribute to the federal money that's being those off-the-top expenses.
Part of the federal money, yes.
One of those is our graduate medical education, right? Yeah.
Yes.
And so that's the $63 million. But then also on top of that, the federal government said that we're also going to need back a lot of the money that you've already spent.
Exactly.
Interesting. Okay.
And at the same time, we have another program that the federal government helps us with, and it's a Children's Health Insurance Program. CHIP, and just referred to as CHIP funds. And over the years, the federal government has funded that at 96%. Well, now then, they're going to fund that at 87%.
Okay.
Now, that's still a pretty good investment from the federal government coming in our direction. But when we start looking at real numbers, therefore, the money that would flow through the Health Care Authority would be at $11.9 million, and the Department of Mental Health and Substance Abuse would be about $2.8 million. And so that's a total of $14.8 million that the federal government says we're not going to fund in this next year's budget that we've been funding. Now, if the state says we're not going to do that anymore, we've got some children that's not going to be taken care of.
That's right.
And so this is something that we as a state said we love our children, we want to take care of our children, so we'll have to pick up this $14.8 million in our next year's budget to keep our health care for our children at the same level we are now inside the state of Oklahoma.
So that's why these expenses are essentially, I keep using the word off the top, but that's why these expenses have been prioritized up to one of the first expenses that has to be accounted for, correct? Okay.
Absolutely. And until last year, this was paid for by the feds. Now then we'll have to pay for it. Until this year, this was paid for by the feds at 96%. They're dropping to 87. Now we're going to have to pick up 14.8 million.
Gotcha.
And so just very quickly, if you take the 31 million and
Right,
back
okay.
out of that, you're at what, 6 and 14, 63 and 14, about 77
Right.
$1 million.
Just immediate additional expense
that's
that
right.
has to be covered.
That we have not been paying.
Right.
Now this year we're going to have to start paying.
Interesting. Okay. So let me ask you this: is this? You mentioned that this is the first year that we're going to have to cover this 31 million.
Yes.
Is that correct?
Yes, correct.
Is this going to be an annual expense that's going to have to be covered for foreseeable future? Or
well, two things there. As far as the clawback money,
okay,
they're done. Once we pay the 31 million back to the federal government,
okay.
we're finished with that.
Okay.
This will be a continual expense for the state of Oklahoma.
Just because it's a continuing
That's right.
service.
That's right. Chairman
gotcha.
Wallace out of the House and I have been working with the Healthcare Authority. We've been trying to get additional funds from the federal government. It's just not happening.
Wow. Okay.
And so this will be an Oklahoma expense, keeping our medical schools open.
Okay.
And we need to do that.
That's right.
I mean, we need to train doctors in Oklahoma.
Right.
We need doctors in urban areas. We need doctors in rural Oklahoma.
Right.
And if we send them to another state to be trained, they're not coming back.
And the
We wanna do
training
it right here.
and the services they
That's
provide
right.
as well. So
Exactly. And the research that goes on with
That's
these
right.
docs while they're here training.
Love that. And then you can't get rid of this just because
That's right.
you mentioned that's not something that can get rid
That's right.
of the health of
That's
these
right.
kids and different things like that.
So, you know, it's kind of a weak illustration. I'll admit that.
Okay.
You know, and everything's going along fine at home. Things are looking good. And then your car breaks down or your hot water heater goes out.
Right.
Well, there's an expense you're not counting on.
That's exactly right.
And so you got a plumber in, you get your hot water tank fixed.
Right.
These were expenses we were not counting on.
Okay, that's a
And
great
then
illustration.
all of a sudden we come back and say, okay, now then we're going to have to come up with about $77 million more for this next year's budget just to stay even where we were last year.
That's right.
In those programs.
Wow. So it's unexpected expenses.
That's
to get
right.
you, right?
That's exactly right. Every time.
Senator, thank you so much for taking the
Absolutely.
time to explain this to us. Again, guys, this is one of the expenses that are kind of off the top expenses that the legislature is going to have to cover this year as we move into the legislative session and we kind of continue the budgeting process.
Right.
So, hope that made sense. And if you do have questions, feel free to comment on this video, but just below in the comment section. We want to talk about the questions that you have. So, if you have any questions about the federal expenses and you know what that looks like on a state level, feel free to ask, and we'll kind of talk about those in our next video. So, is there anything to add?
No, sir.
Awesome.
Great to be with you again this week. Look forward to seeing you next week.
Yes, sir. Absolutely. Guys, join us again next week. We're going to be exploring another part of the state budget and learning a lot from Senator Thompson yet again. So, guys, thanks again, and we'll see you soon. Bye.
Bye.